Okay, let me just see. Righties, let me just see how I can change the setting. Okay, this should be fine now. Loyola, this was wonderful, wonderful story that you told us. And now with my case presentation, I would like to add a little bit slightly different angle on how we can look at trauma experiences and how we can look at the impact of developmental trauma. So I will put this more through the lens of neuroscience and looking at the patterns of dysregulated emotions and cognitions and behaviors as actually dysregulated brain patterns formed in response to survival threat early in life and accumulated throughout the life later on. So I will try just briefly to look at the impact of developmental trauma on brain functioning and how this gets manifested on all levels of functioning. And also to explore complexities of working with clients who have the history of developmental and also refugee trauma, and also to introduce a service provision model that can address this complexity. We will explore together use of neurofeedback and other tools for self-regulation in addressing psychophysiological effect of chronic and complex trauma. And also how neurofeedback and other interventions can be done in the context of therapeutic relationship that Loyola showed us is so important. So the client that I'm presenting came from Iraq. He was 49-year-old male, coming from well-educated family, middle-class Assyrian family from Baghdad. Assyrians are a Christian minority that were persecuted by the Iraqi government for their ethnic and religious background. He was born in a family of 5 children. He was fourth, closest to his mom. Unfortunately, his mom passed away when he was in high school. She died from cancer. He arrived to Australia in 1993. He got married. He has 2 daughters from that marriage. And then, sadly, his wife passed away from cancer last year. Looking at the history of his trauma, his father was an alcoholic. He was volatile and highly aggressive man. He abused the whole family, not just physically, but emotionally and psychologically as well. So he saw many scenes when his father would beat up their mother and other sibling and himself as well. And trying to find a place and person who will give him some sense of security, actually he ended up in hands of a sexual predator, his neighbor, who abused him from the age of 4 to 6. And then, as it happens with many of our clients, trauma started repeating itself. He was frequently beaten up. He was a boy who wasn't aggressive. He was compliant. He wanted to be a good boy. He wanted to do good things. And then he was for no reason punished either by his father or at school by his teachers or by his school friends, attacked on the street. And a part of all of that, he was exposed to war. He witnessed the atrocities, bombing, shelling. And then he went to university as a good student. Instead of getting a reward, he was put in prison and tortured, just for being from a Syrian background, nothing else. After release from prison, he escaped from Iraq. He had a traumatic journey to Greece by a boat, then waiting there for refugee visa to arrive to Australia. And finally, when he came here and settled in Australia and thought that he's finally in a safe place, just place, he was attacked on a street by a random stranger who broke his jaw and he needed reconstructive surgery. He tried to bring this person to justice, but at the court, he couldn't win this case. He didn't have anyone to support his claim. So again, it was shown that he was nobody, that his suffering doesn't matter to anyone, that he's the one to blame, that something is wrong with him, and that there is no justice in this world, not for him. And from all these experiences, and especially after this horrific experience in Australia, he totally broke down. He was suicidal. He had 3 suicide attempts. He was frequently hospitalized. He started to use alcohol and then other drugs to help him regulate. And looking at all complexity of his trauma, he did have symptoms of chronic and complex PTSD, also chronic depression, also OCD traits of frequent washing and checking, and a range of physical health symptoms and issues that we also frequently see. And then other issues such as illness of his wife and financial housing difficulties. And we can go on and on. If we try to diagnose him, he would meet the criteria for several disorders, looking at DSM-5 and looking at ICD-11 as well. But when we look at the core of all these disorders, actually is dysregulated nervous system. I will just briefly mention an article. It is a review article that was published by Ruth Lanius, brilliant researcher from Canada, and her team. They're looking at all papers that were published around brain networks that are affected by experiences of early childhood trauma. And what they came up is that many papers are actually writing about 3 major brain networks that break down as a result of traumatic experiences. First is default mode network. This is a critical resting state network of the brain. And it's actually lighting up when we are resting. And when the brain, it should be in the idling mode. And this is the brain network that is critical for our experience of self, sense of self. And it's also important for recollection of autobiographical memory. Also, to know what we feel and to have embodied sense of self. Frontal part of default mode network is involved in future-oriented thinking, while the posterior one is looking into our past. And then both sides are working well together. We actually have one fine and well-organized narrative of our life, and also well-established sense of self. And that whole beautiful presentation that Loyola just gave us is all about trying to find that sense of self. And through psychotherapy and self-reflective functioning, actually reestablish default mode network. The next network that we can look into is salience network. This is a network that helps us figure out what is important, what is more salient inside ourselves and also in the outside world. And traumatized people often either or underemphasize what is important, and that would be hyperarousal symptoms, or underemphasize significance of what's happening internally and externally. And then we see hypoarousal symptoms, disconnection, feeling numb, disconnected from themselves and disconnected from others as well. And looking at clinical treatment, the whole article is around using different types of mindfulness exercises to activate, integrate salience network. But we can think about all range of body-oriented therapies, somatic psychotherapy, and that all of them together can help to reestablish, to reduce or increase arousal and reestablish well-functioning of salience network. Third network, central executive network, is involved in external world, the external world, our thinking and planning, problem solving, paying attention to the world around us. And when this network breaks down, as clinical symptoms, we see executive dysfunction, problem with attention, with working memory, difficulties is solving problems, and we can keep going with this. Their whole range and everyday growing of cognitive remediation therapies or interventions, such as working memory exercises that are great in reestablishing central executive network, but also are shown that can reduce symptoms of post-traumatic stress disorder without psychotherapy. How this really relates to my client. Looking at his nervous system through using electroencephalogram, measuring of brainwave activities, what really was quite obvious there that he was having hyperarousal symptoms. He has poorly established posterior alpha, resting alpha that with eyes closed should be present. He also had poorly regulated temporal lobes, both right and left. On left side, we could think of difficulties with language processing, reading, writing. On the right side, difficulty in reading social cues, in recognition of faces and facial expression, and also poor interoception. And then as well, poorly functioning frontal lobe that is telling us about reduction in capacity to regulate emotions, but also regulate attention. If you put all of this together, his nervous system was hyperaroused, it was unstable, and it was highly reactive. So to help him initially work through and get some relief from his symptoms, neurofeedback was introduced. We can look at neurofeedback as a tool that can improve central nervous system regulation, almost like holding the mirror to the brain. This is a method where the client is sitting comfortably in a recliner, we put a sensor on their skull, and that sensor is just measuring their brainwave activity and showing moment to moment what is happening internally. And whenever brain spontaneously starts to go in direction of better organization, better regulation, that externally we can see as a calm, attentive state, then in this case, middle rocket is flying faster. And client is given information, your brain should produce more of this. This is desirable, this is good, this is functional. And whenever it's client starting to dissociate or go into overdrive, in anxiety and agitation, then rockets that are on left and right are actually the ones that are winning the game. And that is signal for brain. No, don't go back into that pattern that is known to you. It was formed to trauma, but let's try this middle road. And that's from trial and error. That's how brain learns to re-regulate again. And also that's how we can see reduction in symptoms. So through this reduction in nervous system instability, we also see reduction in fear, reduction in reactivity to trauma-related stimuli. But apart from neurofeedback, in working with the client initially, and the aim was to stabilize him. He stopped taking drugs and alcohol. He stopped taking benzodiazepine to help him fall asleep. But he was hurting. He needed something urgently that can help him regulate in a healthier way. And that's why, apart from neurofeedback, cognitive behavioral therapy was introduced. A lot of psychoeducation about impact of trauma on brain, grounding techniques, help him to recognize his triggers. Also, we were using heart rate variability biofeedback, that is different modality of biofeedback, where through introduction of diaphragmatic breathing and at the same time measuring pulse or heart rate, client was learning to actually work together to integrate his breathing with his heartbeat, so to synchronize them. And that is very nice technique to improve autonomic regulation. And together with that, we were using mindfulness to reduce attentional bias to trauma stimuli, also negative thinking, and to increase his ability to remain present. Resulting to that, we had improvement in sleep, reduction in nightmares, reduction even in his migraines. His mood was more stable. So that was time after 28 sessions to decide to go to this next stage of his treatment, to work on processing some of his traumatic memories, and also another neurofeedback modality that can help in addressing addiction. So client was sober, he didn't take drugs, but he was craving them. And alpha theta neurofeedback was introduced to deal with both trauma-related memories and addiction. Alpha theta is actually very deeply putting clients in a deep meditative state. It's increasing alpha and theta waves, that slow brainwave activity that we naturally produce just before we fall asleep, when we start to have hypnagogic imagery, those first dreams. And when client is in that state, memories that are emerging of trauma that happen are coming for them from a position of witness, so they can process them without getting overly aroused. And this is done together with autogenic training, initially to prepare them and relax their body, and also visualization of different outcome when they feel as if they would take drug or alcohol. So rejection scene and finding healthier way of dealing with stress and anxiety. And also to use affirmations or sentences that are telling themselves of how they would like to be. For this client who was feeling for so long disconnected from himself and his family, his mantra was, I'm learning to connect with myself. I'm learning to connect with my family. I'm learning to connect with nature, peace. And that's his mantra that he was repeating at every session. Alpha theta is, for me, really sacred therapy because client is very vulnerable. We put them in a state when they close their eyes, when they need to let go of everything. And that is also for us opportunity to recreate different attachment model. So our presence as therapist, fully being present with them, non-verbally, just by being there and holding them in that, in the room, holding them in that time when they are processing traumatic memories is very important. Apart from alpha theta, also we were using, and I sent him for behavioral activation to start to exercise. He was overweight and he was keen to do it. And also to join aqua group, to socialize with others. But also this was opportunity to work with triggers because male bodies in the swimming pool with him were highly triggering, but he went there already prepared to work when triggers are there and to learn and to learn to regulate himself in that moment through breathing exercises. So through this process, he was sleeping better. Now also flashbacks and intrusions are reduced. He was better focused. So already there is increase in his cognitive capacity. So he was gaining internal control. This is just briefly what was written in his progress notes after 29 sessions. The client had the visual imagery during alpha theta training of himself being beaten by a group of students at university and how he was kicked in the face. While talking about the event, he felt pain in the same part of the face and a red mark appeared on the surface of his skin on his forehead. After recollecting this experience, the pain disappeared. And the client reported feeling confused. I would usually feel angry when thinking about these events, but I don't feel angry now. I feel some sort of acceptance, if that makes sense. And then he repeated several times, I realize now it wasn't my fault. So everything was going well. And unfortunately, for our clients, many of our clients, the therapy is not about pursuing happiness. It's about living life with dignity, with feeling that their life have meaning and purpose. And for this client, huge challenge came. His wife was diagnosed with terminal illness, lung cancer. She was dying. And then instead of working through traumatic memories, we had to focus on here and now. And my role there was to support him, to support his family, his wife and his girls. And he did that brilliantly. This was also an opportunity for him to create different narrative of who he is as a husband, as a father, as a man, because he felt that he failed them before. And that was something that was coming up in our sessions. He was supporting his wife. He was making her life more comfortable while she was there. He was with her every step while she was alive. And she could die in peace, that he would be there for her girls. He was also a father who was present for all the way with his children. He was there to help them say goodbye to their mother. He was there to help them grieve. While all of that was happening, also he got rejection letter when he applied for disability support pension. This was for him huge blow again. Again, he was devalued. His pain, his struggles were not recognized. There was no justice. That was confirmed once more. And that was then frequent narrative that he brought to the sessions. But I also could see how this anger is a fuel for him to keep him going instead of falling apart, focusing on something as a next goal. So I helped him apply through tribunal, and then decision was made. He was granted disability support pension, and even he got the apology because his case was not, it was mistreated. So that actually moment when he got this, the pension and apology, in a way symbolically also was apology that he hasn't received before from his father, from other perpetrators, for other hurts that he experienced. So he could put this behind and resolve, and that's when his anger went down as well. And what he said to me is that all up to that point in his therapy, before his wife got sick, was actually preparing him for that moment so that he can take this role, that he can be a man that he wanted and was never for them. So we again could observe that he was coping quite well. He had stamina, he had stability to go through this difficult time. And then another disaster. He lives 3 hours away from Sydney. There was bushfire, and then there was COVID-19 crisis. And again, we were dealing with what was coming, mostly through phone counseling. So going back to mindfulness, meditation, relaxation, lifestyle intervention, just to keep him going. But throughout that time, he was stable, he was mindful, and he was self-reflective. Finally, in July this year, we managed to continue his treatment. And now also his neurofeedback treatment shifted to work more on reestablishing default mode network with specific protocols that we use. That is also helping to deal with early attachments and hurts. And together with that, we were using somatic psychotherapy to work directly with his body memories, what was it he is experiencing while the memories were emerging. He was also ready for metta meditation, self-loving kindness meditation. And frequently we had to revisit his attachment with his mother, with his father, what was happening when he was sexually abused. He improved further. He slept better. There was better self-organization. He was calm and grounded. There was the beginning of self-acceptance as well. And he had different quality to his attachment. He described this whole process as he was in a car, but someone else was driving his car. He didn't know who the driver is. He was sitting at the back of the car. And then as his therapy progressed, he from time to time was able to lean and take the wheel and steer in the direction that he wanted to go. And then one day, he was actually at the front, sitting next to the driver and having more control over the wheel. And then more and more, there were moments when he was the one who was driving and he could move left and right, and he could decide, and he could make decision what to pay attention to and what not. And in one of his most recent sessions, this is what he said. And this is actually about really pre-establishing Salin's network. On his way to the session, the client was aware of his enhanced hearing ability. He could easily distinguish different sounds and was able to shift his focus at will. He described his experience as, I felt as if the brain was no longer occupied internally and has more capacity, more attention available for the sounds from outside, such as the sound of the bubbles popping up on the surface of the can of a Pepsi. I was able to separate the sounds and to choose where to direct my attention. But also, he was reporting changes in his relationship with his daughters and his ability to switch between his father and mother role. So that's really very fine tuning into what they needed and how can provide that for them. Looking and tracking his progress over time with self-report measures on trauma, anxiety, and depression symptoms, we could see this was a bumpy ride. So it was a smooth recovery. But what we can see over time, there was reduction in his symptoms. And also we can see improvement in his attention and working memory. There were some positive changes in his brain functioning as well. Even if we just look visually pre to post-treatment raw EEG, we can see the post-treatment EEG was better organized. So his EEGs was starting to look more rhythmic, better organized than before. And also we could see some shift in an formation of posterior alpha, resting alpha, increased ability to relax, reduced in hyperarousal, some change in temporal lobe functioning improvements as well, and starting to also improve frontal lobe functioning. So what do we do now? We decided together that now is for him time to go to basics, to exercise more. He was referred to a nutritionist as well at starts, exercise therapist also. But he also expressed desire to paint and to play piano that he used to a long time ago. And he was ready for social activities, so he's now referred to yoga class that he enjoys very much. When I look back for the journey of my client, our joint journey, I believe that in working with clients with a history of developmental trauma, neurofeedback and other neuromodulation tools are becoming essential modality that can help reorganize pathological brain oscillations formed through early experiences and through horrific torture for those later in life who were traumatized. It can help to improve self-regulation, quieten fear, and reduce brain reactivity to trauma stimuli. However, I also believe, and Loy presented that so well, that essential ingredient of trauma therapy is persistence and calm presence of a therapist who will stay with the client, no matter what, through difficult times, to pain and despair and self-hatred and anger and fear, and keeping the possibility and hope that they can get better, that they will get better. And also holding a mirror, giving different reflection of who they are, different image of themselves, and keeping that until such a time that the client can feel ready to look in their own reflection and recognize themselves for who they really are. Thank you very much for your attention.